Well, welcome everyone, and I'm going to give a little bit of a talk. It'll overlap the talk I gave at OHDSI. I think if you're a newcomer, hearing something a second time is a healthy thing, and if you're a newcomer who couldn't come to the symposium, hearing the first time is certainly a good thing. My name is George Hripcsak. I'm director of OHDSI's Coordinating Center at Columbia University, and I work at Columbia University, unsurprisingly. Oh, it's not. Hold on. There we are. OHDSI's mission is to improve health by empowering a community to collaboratively generate the evidence that promotes better health decisions and better care. Almost every time we start a meeting, or a big meeting at least, we read OHDSI's mission. It reminds us of what we're doing. We make a million little decisions all year long, and we make sure that each of those decisions is aligned with our main mission, so we don't go down a rabbit hole, but use our resources wisely to achieve our goal, which is better health. Our values are innovation, reproducibility, community, collaboration, openness, and beneficence. Here is how OHDSI's is structured, more or less. So we have our large OHDSI community shown in orange, and we develop data standards, open source tools, methods, and designs of studies. Using all that, we design network studies, which are distributed over our data network, shown on the left in green, where our partners have databases they convert to our common data model. We share the network, the study design with the network. People voluntarily run it and share the results back centrally, where they're interpreted and published as a community effort. So we end up with papers with a lot of authors. Here's a map of our collaborators, almost 4,000 now in the Teams environment, typically 100 or 200 on our Tuesday calls, coming from a total of 83 different countries. We have regional chapters to accommodate. I mean, when you're working in a global environment, it's nice if you have a mechanism to work with people who are local to you, so you can work out, address problems that are specific to your geographic location. And therefore, we have regional chapters as shown here: Africa, Australia, China, Europe, India, Japan, Korea, Singapore, Taiwan. We welcome others. Let me emphasize that. Within the European National Network, we have European national nodes, the different countries that are actively participating in OHDSI. The backbone of OHDSI comprises its work groups, and shown here are the work group leads, people who donate their time to OHDSI to keep the whole thing going forward. We have over 20 work groups who are pushing forward the OHDSI mission, in some cases generating code, developing questions, focusing on clinical problems, focusing on governance, and so on. So as a newcomer to OHDSI, this is the place where you should volunteer to join the effort. You'll not only, it's not only a place for you to do work, but to meet other people and become part of the community. Here's our OHDSI's common data model, the OMOP common data model, shown as an entity relationship diagram. This data model, we're proud of it because, as I said earlier, we're focused on our mission. And our mission has driven us to create this data model and not some other data model. That is, every time we make a change to this data model from the earliest versions till now, it's always with an idea of what will help us generate evidence and improve healthcare the best. In order to be a worldwide effort, we have to accommodate many vocabularies, many languages. So we have the OHDSI standardized vocabularies with 11 million concepts, which are drawing mainly from standardized vocabularies from around the world. And with 80 million relationships. And this is how we organize our information. People have adopted the OHDSI OMOP common data model. Shown here is all the countries that have used the OMOP model, over 500 data sources. So there are 956, actually this is a lower bound because we're not really counting, the way we do the count, it's a lower bound. At least 956 million unique persons, actually we should reorder that phrase, unique persons around the world who have had at least some of their medical record converted to the OMOP common data model. That's over 12% of the world's population. One of the important initiatives is Hades. This is our set of open source R packages for large scale analytics. And that includes everything: characterization, causal inference, patient-level prediction. This is a place where newcomers can contribute. If your penchant is in developing software, and if you're in love with open source development, we would love to have you join us and help us push our many packages forward. As you can see, our Hades packages on CRAN have been downloaded more than 500,000 times. Scholarship, we've generated over 600 publications and with 12,000 citations. Here's our OHDSI collaborators shown as a social network analysis. In the past, in the foundation of OHDSI, this was shown as a bunch of nodes, and we go through, well, here's the group that's focusing on this, here's the group that's focusing on that. Now that we've matured to almost the 10-year mark, coming very close, we've matured to a single coherent whole. And one of the features of OHDSI is that the people who work on the data model also contribute studies. And the people who work on the vocabulary are also doing software development. And the result is that the people who are working on it know what's needed in the other parts, and they don't go off again in some direction that's not beneficial to the overall OHDSI mission. So by being kind of vertically oriented through the whole stack, we keep ourselves on the mission. We've had a strong impact. I don't want to overuse some of our examples, but still I'll go over these. They have evolved over time, I promise, but I'll go over some of them. Our first large network study was in treatment pathways. That is, we know what's in the guidelines and we know what drugs are being sold by pharmaceutical companies from their inventory, but we don't actually know what people are taking or being given. And so we said, let's look around the world for 3 chronic diseases: type 2 diabetes, hypertension, and depression, and see what pathway of drugs do people take in a 3-year period when they're first diagnosed with the disease. We found a number of things. We found, for example, in diabetes, most people start on metformin everywhere except for Japan, and we found out the reasons for why Japan might be different. For hypertension, there's similarity, but there's more diversity than diabetes. And in depression, there's almost no similarity. Every database, even in the same country, look completely different from every other database, which makes sense because we don't really know how to treat depression well and what drug is going to affect what patient. But most interesting, perhaps 25% of hypertension patients took a sequence of drugs in 3 years shared by no one in the entire 240 million population that we surveyed. So think about it. I have a population of 240 million people. I took this sequence of drugs. I look, I find no one else in that whole population who took the same sequence of drugs as me. Now, there are a number of hypertension drugs, so you could see how it could happen, but it shows that we're not practicing precise medicine. We're not following guidelines, and we are following the guideline. They're not precise enough, and perhaps OHDSI can help with that. We studied large scale. We have many ways of doing studies, many different study designs, and we used our approach to negative controls, do a large scale study of all different methods to determine what methods would be best. There were a number of results there. We found certain designs were better than others. Historically controlled studies tend not to be as good as the better controlled studies. The sad one was that when we do vaccine surveillance for safety, the type 1 error rate, which is supposed to be 5%, that's the definition of a p-value, all around 40%. So that means we're sitting here arguing about phenotyping, arguing about this, arguing about that, but in the whole, we are getting it wrong by a factor of 8. Background incidence rates, 2 years ago, the AstraZeneca vaccine got shut off in Europe for 13 countries. They asked us to generate background incidence rates for them. We just happened to be doing research in the area of how to generate background incidence rates at the time, so it was fortuitous. And we did that, and they used our data to determine that the AstraZeneca vaccine, while it had some rare clotting, on the whole, it did not increase the incidence of clotting appreciably, and that the benefit of the vaccine far outweighed the risk, and they turned AstraZeneca back on for 700 million people. And last, our legend hypertension study, where we validated the clinical guidelines. Clinical guidelines, because there's only a few randomized trials, are mostly based on expert opinion, and we filled in that gap by doing 500,000 studies. We found that the US guideline was quite accurate. We agreed with it for the most part. We had some disagreements. We predicted where those disagreements are. There was a randomized trial testing that exact thing, which was due to come up in 2 years. We disagreed with the prevailing evidence and opinion, put forward our study that got lambasted in the letters. 2 years later, the randomized trial validated our results. So we're very proud of that. For more information about OHDSI, see Our Journey online, the 2023 edition. Most of my slides are taken from that. Thank you, Craig, for putting that monumental work together. With that, I will turn it over to Patrick for your questions.
I think what we'd really like to do is actually use the rest of the time to welcome our new collaborators to the community. And actually, Craig, I'll let you facilitate this, and I'm going to turn off my camera so that we can actually, everybody else, if they can put on their camera, introduce themselves. So I'll let you run that, Craig. And I guess probably if folks can use the hand raising function in the tool, but we really want this to be mainly an opportunity for new folks in the community to come and introduce themselves. I see that people are posting questions in the poll everywhere. So I'll just remind you at pollev.com/PatrickRyan800, you can post any questions you have. And we're actually going to use those as the impetus for having a Q&A session next week, where we'll drive all of those questions, go through the answers to all of those questions. But right now is a great time for those of us who've been in the community to hear and learn from the new members of the community who have joined the journey. So Craig, I'll let you facilitate that.
Yeah, so while people raise their hand, I want to give a quick run through of the website and teams to make sure that everybody knows where you can find information as you go. The main website is ohdsi.org. Hopefully everybody has at least seen that. There's a lot of information on the page that you can kind of go through, but I did want to highlight a few things. During the drop down up at the top, the who we are is where you can find our mission, mission and values, Titan Awards, a number of other things. Recent updates and news, you can see different collaborator spotlights or updates that we want to provide. Please check out our news and updates page every now and then to kind of learn some of the bigger things that are happening in the community. We have a page on standardized data, which really looks at the OMOP common data model, so you can learn more about that. We have a section on software tools, network studies. I especially want to highlight our forums, because this is, as we've said before, an open science community, an open community. So we want to put as much as we can out in the public domain. That is why we use the community forums to ask questions, and ultimately a lot of times they turn into threads where there's a lot of discussion back and forth, and these remain on the forum, so you can go back, look through them, and learn what's happening. But again, it's a great place. You don't know, obviously at times there's a direct email, but that isn't, of course, public. But also, if you don't know a question, the forums are a great place to just post it and allow anybody in the community to respond. So I do like talking about the forum. For those new to OHDSI, so we have a section on what to do if you're new to OHDSI, as well as education, like the Book of OHDSI, the Eden Academy. The Book of OHDSI, this is different than the Our Journey. This was done in 2019, but you can see how detailed, how many aspects of what we do in our community are available there. So please do check that out. Eden Academy as well. I mean, there's a lot that is available to everybody. These community calls happen each Tuesday at 11 a.m. They are recorded. The videos are posted to our community calls page. So if you're ever interested in a topic that happened in the past and want to kind of rewatch that video or any updates from any times, all of the publications that I highlight each week, they go on that page. Past events. This is really, we have symposiums every year, but there's also been face-to-face. There's Asia Pacific symposiums, our DevCon, and we really make sure we house all of those videos, all of those presentations, because they are, an educational resource for you. So please do check that out. I mean, you can see all of the different meetings and materials that are available to you. Work groups. George touched on the work groups. We have around 30 active work groups that we have on a page We have brief videos where you can kind of learn about what they're doing, what they're up to, some future goals, OKRs, or objectives and key results that we had this year. We'll update them again next year. There's also a way to join a work group and the weekly work group meeting schedule. I'll just highlight this. So if you're ever curious on when work groups meet, you can find out here. Joining a work group, we do that mostly in the Teams environment. So I'm going to pop over here. It's really important to, if you can, to join us in Teams, because all of the different work groups that we have are done in the Teams environment. This is how you meet. You can do asynchronous file sharing, recordings of video of meetings. Such happen inside of Teams. It's been a great collaborative platform for our community, and so there are ways to join Teams. You can, under work groups, you can join our Teams environment, join our work groups. They're very brief forms that Elise does a great job getting you to the right spot. So please do check that out. As George mentioned, the latest Our Journey annual report is now up. Any of those graphics that you saw George share, they're all available in this book. Obviously, this was also shared at the symposium. Paul Nagy and his team set up a community dashboards page, which has been updated recently. Has a number of things that you can look at: publications, data network, open source tools, opportunities. So it's, again, a great thing to peruse. This Week in OHDSI is a little similar to updates, but really focused on what's happening recently. Publications is part of the community dashboards, but I really like that, having that as a standalone, so people who are new can go right there and get links to all of the publications. We have a page on how to support and sponsor OHDSI. The Global Symposium page, we're working on getting the videos of all the presentations. So once we have them, that's where they will be. But you can go right now and drop down to our Collaborator Showcase page and find all of the different posters and brief reports from all of the different showcase presentations. I mean, you can see we had a record number of showcase presentations, posters, demos, and then, of course, the lightning talks will be there as well. Then we have direct links to GitHub, our YouTube page, which has a ton of videos, a ton of material that you can learn from. And, of course, everything from the symposium will be there as well. Links to Twitter, LinkedIn, and then our newsletters are great monthly resources for information, links to all the publications, presentations, what's coming up, kind of everything you need to know. If you don't get it on like the first of the month or the first work day of the month, please do subscribe so you can get it in your inbox. But also we have them here. Each month's newsletter is linked to, or is in this newsletters drop down. So that's a quick run through of the website. I invite everyone to check it out, to peruse it, and to because it really does have a lot of resources for learning about our community. So, all right, I see a couple of hands up. Hopefully a couple others will join after, but I'm just going to go through in order. So, Kavishwar, do you want to just start? Introduce. I'm going to stop sharing, and then that way we can see you. Great.
Hi. So I'm. My name is Kavi. Full is Kavishwar. So I'm an assistant professor at Mass and Brigham, and this was my first ODC. It was an amazing experience. In terms of the collaborative experience was amazing. The amount of people I got to meet and had a very productive discussion about the tooling. So in brief, my research is focused on phenotyping in the cardiovascular space. So I hope to contribute to the phenotyping pipeline, the HDSI packages, and how often would be a great project for me to engage in to get on the stack.
Great, Kavi. Thank you so much, and thank you for introducing yourself. And you said, if there's any questions specifically, we'll talk next week. Please include them in the poll everywhere. But it is great to have you. Ease or Ezzy? Apologize if I butcher any names here.
Ezzy.
Ezzy.
Can you see me? My name is
I see you
Eze.
now. Yes.
Yeah, Eze Herbert. From the Great Ormond Street Hospital in London. A data engineer with the DRE, which is the aspect of the hospital that deal with data. A colleague of mine told me about OHDSI, although I've joined the OMOP Fire group. I wasn't able to attend the symposium because it was a bit, close. So I'm just looking at the YouTube channel in terms of the OMOP on Fire. So I'm doing a whole lot of learning at the moment. Part of my role was to map some OMOP data to Fire and then do the reverse. So that's what I'm learning at the moment anyway. Thank you, and I'm happy to I'm going through the work group. I mean the other aspect of it in terms of joining the joining the open source programs. Going to be learning more basically. Thank you.
Great, Ezzy. Thank you so much. Yeah, the Fire and OMOP work is, really kind of in the early stages. I know they had a full day event on Sunday, but there is certainly room to collaborate in that effort. So that's exciting to hear, as well as certainly there's a lot of work in open source. So we have an open source work group. We have a Hades work group. So a lot of opportunities. So it's exciting to hear you're interested in that. Thank you. Next up, Holt.
Hello. So my name's Holt Oliver. Your background as a clinician in oncology, and then a focus in clinical informatics at the Parkland Center for Clinical Innovations, which is a kind of informatics focused nonprofit affiliated with the County Safety Net Hospital in Dallas County, Dallas, Texas, and attended the previous weekend's symposium, and I greatly enjoyed it. I think, like you said, the community very open, and met a lot of very helpful people in terms of trying to advance the projects that we're working on, which include taking a completed NIH clinical trial where we're going to have our data sharing object be an OHDSI representation of the final clinical trial data, or OMOP CDM representation of that, and implementing CDM for a partner hospital in San Antonio that's focused on transplant surgical population.
Great, Holt. Thank you very much. Certainly, if anybody has, because we have some veterans in the community, if you have any ideas or suggestions, feel free to voice them, either jump in or add them to the chat to help people kind of, now that they're voicing and introducing themselves, how to kind of take that next step. That's always great to hear. Okay, next up, Kluivert.
Yeah.
I heard you for a second there. All right, there we go.
Yeah. Good afternoon, everyone. My name is Kluivert Bwachdu, and I'm a first year PhD student at Queen's University Belfast, and I'm working on mapping cancer data set, that's blood cancer, particularly chronic lymphoblastic leukemia and myeloma, to the OMOP CDM. So I'm also new here, and I've just started learning how to map data to the common data, to OMOP CDM. Yeah, probably after that I will do some analysis using Hades. Yeah.
Excellent. Well, thank you for your work on that. There are, a lot of, we talked about some of the educational resources. There's been a lot of presentations and work done on mapping data, but certainly if you need help, please do reach out to either the CDM work group or anybody, because there's a lot of people who can help in that important effort. So thank you. Next, Adam.
Hello, I'm Adam Lee at the University of North Carolina. I was at the symposium. This is my first in person, so I'm not new to OMOP, but I feel it's always been tangential. So I co-hosted the OMOP to Fire Connectathon, and I kind of teased at work groups, but I had my blue dot on my name tag, and so like I feel again new and coming in like the proper channels. So yeah, I'm kind of looking forward to like officially getting in there with support and being part of the community instead of just being like virtual.
Yeah, it is. It's a whole different world when you're having the face-to-face opportunities. Were you happy with how the Fire and OMOP activity
Lots
went?
of lessons learned, but I'm not unhappy. I'll say that one. So we can always do better.
That is the Odyssey mantra. There's always room to improve, but not unhappy either. So that's great to hear. Thank you for your work and leading that as well, and for introducing yourself. Next up, Celeste.
Yeah, that's me. Hi everyone. Just thought I'd sprinkle in some feminine energy. I'm a health data scientist based at Oxford University. I'm jointly held between the Big Data Institute and the John Radcliffe, and I also have a lab in London. So I'm very excited to get started and meet some people and potentially get involved.
Great, Celeste. Thank you very much. I know we had a few people from Oxford at the symposium. Were you able to make the symposium, or
not this time? Okay. A bit hectic this summer, I'm afraid.
I hear you. Hopefully sometime in 2024. But thank you. Next up, Laura.
Hi everyone. I'm Laura Kerr. I'm a data engineer at Genomics England, based in London. I've been working on OMOP for about a couple of years now, mapping a number of NHS data sets to OMOP, as well as the primary data we collected as part of the 100,000 Genomes project. We're hoping to have our first ETL ready to go back into this year, and there'll be a bit of refinement as we go through that. We've found a few little challenges along the way regarding some gaps in the standard vocabularies, and we're trying to find ways around it. But so far, I think making good progress, and we're hoping that when we're able to put it live, our researchers will find it useful as well.
Great, Laura. Thank you very much, and good luck with that. I don't see any other hands raised. I'll give another moment. But I also know we have a number of people who have been in the community for almost the full 10 years, but also some who are maybe 1 or 2 or 3 years in. So does anyone have any advice that they want to share about whether you've been in the community for a long time, just kind of who to reach out to, how to make your way, but more if you've been in for 2 or 3 years, like what are some of those first steps that people took that, it can feel overwhelming at first, no doubt. Anybody have any advice or suggestions for kind of breaking in and starting to make an impact? Atif.
Thanks, Greg. Atif, Adam here from IQVIA. This was my second year. It's my first year as part of the planning and steering committee. To break in, I think the easiest way to do is just ask. Do not worry about if it's a stupid question. If it's a stupid ask, just ask. The community is extremely open, extremely friendly. Even if they don't know the answer, they will connect you forward. I think that's the best thing that I've learned. I think the other thing also that has been useful being part of the steering committee is to really understand the workflows when you actually participate in different events and different things happening in the Odyssey community. You get a much better personable handle of being part of different things happening in the community. Being part of the steering committee, I think I got to understand the complexity of organizing an event, but also got closer to all the members, including Mark, Patrick, Craig, and Elise. And it was really useful to just understand the people behind the work happening. So I would suggest you volunteer and participate in as many events, be it online or in person, as possible.
Thank you, Atif. Atif is really a great example of somebody who's relatively new to the community, but really kind of jumped in. I mean, he's helped take over our health equity work group, which is, of course, really important and a fairly young work group. And he's really helped kind of lead it forward this year, as well as joining the steering group and other work groups. So thank you, Atif, for your help and for for contributing here. Roger.
There, I'm on now. Yeah, the first thing I did, I guess I've been in OMOP now for like 5 years, almost 6 years. But the first thing I did was I joined work groups. And you don't have to know anything in order to join a work group. I mean, a lot of times everybody, you feel like, oh, if you're going to join a work group, you have to be an expert in this because they're going to ask you to do things. But I didn't know anything about the common data model, so I joined the common data model work group so I could ask questions. Sometimes stupid questions, but I would say more naive questions that I didn't, or I make some naive assumptions that then, were I could be disabused of, and so I would encourage anybody, even if you're just brand new to it, to find a couple of work groups that sound interesting and just join them. Maybe just listen for a while, but also pipe in with your naive questions, because I've had some of those and they said, oh, wait, that's a really good question. Like, you get to be an expert in something and you forget what newbies don't know. And so that would be my advice.
Thanks, Roger. I really think that's excellent advice. There is no expectation when you join a work group that all of a sudden you are going to be tasked with major responsibilities. It's okay to join and listen, and when you're ready to ask questions, but also, bringing a new perspective, bringing, what you fear might be a dumb question actually is probably a question that other people have and may spark a different conversation that, leads to new ideas or new directions. So I think it's a wonderful piece of advice, Roger. Thank you for sharing. And I did just put the link to the how to join work groups in the chat. If you don't get the chat, again, it's on the OHDSI website as well. Andrew.
Yeah, I agree with everything that's been said and add that if you're joining for the first time and you don't know exactly where to go, sampling work groups is a good thing to do with an eye to the fit between your motivation and the active work in that group. And the disconnect can give you the wrong impression. You could be an epidemiologist, come to a work group and see that everything is focused on vocabularies and ontologies and discussions that really are not what you thought they were going to be talking about. You thought maybe they're going to be talking about heart disease studies or something like that. And so you might need to shop around with an idea that the name of the work group and even the OKRs may not give a clear sense of how your motivations fit with that work group. But if you keep shopping around, you'll find the place where it does fit. Maybe you go to the methods group. Maybe you go to some other place that's a better fit. So I'm just reinforcing what was said earlier, and I know that that's been a challenge for some folks who are new to the community. They think there's going to be something that's squarely in their space given the title, but if you keep searching, you'll find it.
Absolutely, no question, Andrew. Hayden.
Yeah, I'll just emphasize the first bit what Andrew said. I mean, I definitely agree with all of it and what people said so far, but we do need both the clinical sides, the technical sides, all of that matters. Some of us don't have the cardiology background, but then some do have the cardiology background, but they don't have the developer technical background. So it takes all of that. The other point I would make is if you do feel like you have a fleshed out idea and you just need to put it somewhere, the forums are great. There's no reason if you get to the point that you feel like you have something worthwhile to put down that it shouldn't go on the forums if that's kind of your style, and no one's going to go and delete it as long as it's not completely kind of just ramblings. I imagine if you really have that idea, that's a great place for it. And people, you never know who's going to come by in a month or so and say that fits exactly with my research and want to kind of pursue it.
Absolutely, Hayden. Great advice, and yes, the forums. I mean, that you can go down the threads of within the forums and really find just a lot of information and great conversation. I will add, these community calls are we try to keep them informative, but also interesting and fun. We change formats. It's not the same thing each week. We specifically work on trying to tackle all different aspects of our community, have different people present. We have debates, we have tutorials, we have a lot. So please do continue to join these calls. If you ever miss, you know now where to find it on the website. But this has been really productive and helpful, and thank you to everybody who introduced, and thank you again, I'm going to say it again, to everybody who helped put together the symposium over the weekend. I'm really looking forward to getting those videos, getting them online, so anybody who missed can share in it as well. The poll everywhere is being left open. I'm going to put this link in the chat one more time. So if you do have questions, we have some great questions up there already, but this will be the focus of next week, to really just look at the questions that you have and try to answer them. Because like I said, if you have the question, probably somebody else does too. So it's a great way to try to build the knowledge and help you kind of with your first couple steps into the community. So thank you to everybody who joined. Hopefully have a great day, great week, a little rest from the symposium weekend, and we'll see you next week for part 2 of our Welcome to OHDSI. Thanks, everyone.